afternoon, everybody, and welcome back to our COVID-19 press briefing in return. My name is Jennifer Wichman. I am the emergency manager for Ward County, and speaking for us today, we have Lisa Clute with 1st District Health Unit, Randy Schwan and Dr. Sather with Trinity Health, Dr. Mattern, also with 1st District and Trinity, Jim Rosted with the Minot Public School Board, and John McMartin with the Minot Chamber of Commerce. So up first, Lisa.
Good afternoon. Just quickly, I will run through where we're sitting at today as it relates to COVID cases in the 1st District area. Just a reminder that the 1st District area covers Bottineau, Burke, McHenry, McLean, Renville, Sheridan, and Ward. So to date, we have done 18,672 tests within our district. Currently, a cumulative positivity rate in the last 7 days is 4.6%. That's all counties combined. The total positive cases we have had are 645, and we have 179 current active cases within the district. Just to illustrate the trend that we are seeing at this point, in June, we had 4,672 tests, 33 positives, with a 0.7% positive. In August to date, realizing August isn't complete, but for the month of August to date, we have done 11,359 tests. We have 347 positives. And this past week, we have a 4.6% positivity rate. So our message has not changed, and it continues to be good, sound public health advice. We ask that you use good hygiene, that you keep practicing social distancing 6 feet apart, wear a mask, and wear a mask properly. There is a lot of information online, websites, a lot of information out there on how to utilize your mask properly. That will increase its effectiveness. And wear that mask when social distancing can't be maintained. So again, our message has not changed. We know that this slows the spread, and we encourage everybody in the community to help us slow the spread. 1st District's role, however, has changed a bit since our last press conference. 1st District is no longer doing the contact tracing. That has been turned back over to the state of North Dakota Department of Health. They have increased their capacity to do that, and we had additional roles with testing and so forth that we moved our resources over to. We have increased our testing capabilities throughout the 7 counties, and I just have to take this opportunity to thank the National Guard for the incredible help that they have provided us in doing that. We have 12 National Guard people that are assigned to us at 1st District that are helping us in various ways in regards to testing. We do have a static site, in other words, a site that is open Monday, Tuesday, Thursday, and Friday, every day from 8 to 2:30. I'm often asked about the 2:30. That's because we have to get the tests down to the state lab that evening. So we have the capabilities of doing at least 100 tests per day, sometimes more, at that static site. Those tests are conducted by appointment. Please call. At this point, we have been able to get anybody that wants a test in on that same day, if not the next day at the latest. We also have continued going out into the communities with our mobile testing sites. And so we have done that throughout the 7 counties. Those testing sites are based on community requests and response to previous testing sites or testing events. So you can always find that information on the 1st District Health Unit website, fdhu.org. If you do have a situation that you would like to consider us going out into a county, please contact 1st District and we'll look at that. Another big effort with testing this past week has been with the universities and colleges. So we have been at MSU. We have tested 4 days thus far, I believe, at MSU. They've had great people helping out there and have trained under our staff as to how to do their testing. So I know that they will become more capable and able to maintain those testing events. We have also been to Dakota College at Botno and tested there. We will continue to support the goal of the governors to have university students tested, and so that's why we are out there. So right now, the way testing goes is we do the actual test, the swabs, and we send those to the state lab. First District's responsible for assuring that those tests arrive at the state lab on the same day that they are conducted. North Dakota Department of Health does the lab analysis of the tests and are responsible for contacting individuals as to the results of their tests. If you have any questions regarding your test results, information is available as to how to contact the North Dakota Department of Health on their website. We have been told by the state that at this point, positives will be contacted within 48 hours and negatives within 72 hours. The other role of First District, as defined by our Board of Health, is to continue to promote and provide guidance to the public on the North Dakota the governor's North Dakota Restart guidelines. We do that by assisting organizations, business and event planners in interpretation of those guidelines. We want to make sure that it's clear we do not approve or restrict any events happening within the health unit. Those decisions are the organizers and businesses' decisions. If they choose to hold a large gathering, we're available to give them recommendations on how they might provide that in a more safe manner to reduce the spread of COVID. It's important to understand that our role is as an advisor to the community on those events. Currently, First District Health Unit continues to offer services by appointments. We do that at the offices. Our doors are not open to the public, but we have people available to escort you in. If you are there for testing, we have testing available in the old Easter Seals building next to First District. So utilize the same parking lot and go there. The other thing that we have taken on, and I want to stress the importance that we place in public health on a strong, robust educational system within our community. First District believes that it is a priority for our community and for our 7 county health units to maintain those educational systems. Hence, we are working as consultants to the districts throughout the 7 counties. We have provided them toolkits on strategies on how to reduce the impacts of COVID on their educational system. We're providing analysis of epidemiology information that we have that is obviously confidential, but we can provide analysis of that epidemiologists and give that to the schools. That will help identify clusters that they may have that may impact their school districts. We do, the state health department contacts us with positive cases. We in turn contact the schools of positive cases, and the schools have been incredible on working with us and assisting. Well, we actually are assisting them with close contacts or identification of close contacts. I have to emphasize again, we really need the community to assist in preventing the spread to assure these schools can stay open. We know how important it is. And in order to flatten that curve, once again, we need everybody's help in doing so. So please consider the recommendations that we are providing to you. They are good, sound recommendations, and we know that they work. The science has proved that. I also want to emphasize these have been extremely difficult decisions being made by schools, businesses, organizations in our community. And right now, I know that none of those decisions are made lightly. So I encourage you to respect each other's actions in regards to the recommendations and be responsible for your own health. If you aren't comfortable in attending a particular event, don't go. You alone are responsible for protecting your own health. So I continue to stress that. So if you're out in the community, help us slow with the spread. But once again, you are responsible for determining what is safe for you and your family to attend. So with that, I will stay tuned for any questions that you might have. Thank you very much.
Thank you, Lisa. Up next, we have Dr. Sather and Randy Schwann from Trinity Health.
Thank you. Afternoon. Seems like yesterday we were here. So I've got a few categories of things I want to go through, and then turn it over to Dr. Sather for some information, and then I'll wrap it up at the end. So while we can't give daily updates on the number of patients coming in and out of the ER and ICU, and whether they're COVID or flu or whatever category they might ride in, I wanted to give an update, kind of a picture of where we're at today, and maybe how we got here in the last few months. So back in when we were doing these on a regular basis in March and April, our inpatient admission to the hospital of COVID positive patients was 1 to 2 a week. If you recall, after almost 2 months, I think our number of patients that we had total was in the teens. So in the last, June and July, the pace definitely picked up, and our average daily census in the hospital for COVID positive patients was around 10. per day. Not 10 new admissions, but 10 inpatients at any one time. So there's more coming in, some going out. Over the past week or so, we've seen another increase in the activity of COVID positive patients, and that's one of the reasons why we're all here today, is to stress in the community that the numbers are rising. You've seen that on the statewide data. You'll see it in local data. We've seen it in our census report that as of today, we have 16 patients in the hospital that are COVID positive and in need of treatment. They're sick people. So 16 today is one of the highest one-day numbers we've had. And just testimony to how we are going as a region and a community in higher prevalence of COVID among us. So far, Trinity patients, the Trinity Hospital has served 64 total positive patients as inpatients at Trinity. So capacity at the hospital, how much room do you have for patients at the hospital? Our capacity at the hospital isn't governed by space or even number of beds that we might have in the hospital, as much as it is other resources to support those beds in terms of nursing and therapists and physicians and specialists. And that's a very fluid, moving target from day to day. So every day, the nursing leaders and other department leaders around the hospital discuss and plan to maximize that capacity at any one time. Of course, that changes based on vacations and people who are out ill, people who call in or who might be quarantined, and so on and so forth. So whether it would be COVID or flu or any other season of the year, these conversations take place on a daily basis. But we are not full. We are not overflowing with COVID or any other patient. We are at capacity in certain areas today, and we'll gain capacity tomorrow in some areas, and we'll get shorter capacity, less capacity in other areas. That's just the nature of the hospital across the state and across the nation, so that's not new. But we were slow to get to this number. It took months to get to 16, and I think that in large part is testimony to the work that is done in our community by our residents, by our businesses, to reduce the spread and slow the spread by practicing good masking, good isolation, or at least good distancing, social distancing, great hand hygiene, those kinds of things we've done very well in. And as the numbers increase, of course, it just calls us to even a higher level of compliance in those areas, right? These hospitalized patients and those who are going to come today and tomorrow and next week are your neighbors, your family, your friends. We all know these people. They come from our region. And so do it for them, if not for you. We have a responsibility to follow the guidelines and slow the spread and keep others around us safe, especially those in the vulnerable populations. I want to go through some overall staff testing. We've tested over 3,500 employees, so we've tested them over and over in some cases. But 3,500 different employee exams or swabs were taken so far. Currently, we have 13 staff that are quarantined because they have COVID-like symptoms. They haven't received a test result yet. And we have another 11 staff who are quarantined due to being positive for COVID-19. Total, to date, we've had about 51 staff who have been tested positive for the virus. That's a population of about 3,000. So we're less than 2% of our population, which we're not pleased to see any that are positive, but given the prevalence in the community and the spread and the position we put these frontline workers in and It's just, it's a number that could be a lot worse. So credit to the folks who are maintaining high vigilance and compliance to these kinds of things of hand hygiene and masking, and that would be the staff and families of Trinity Health. Dr. Sather will speak a little bit about some treatment and supplies related to the treatment of COVID-19 patients. So, Dr. Sather.
Thanks, Randy. I want to start out just to tag on to some things Randy said. It seems like yesterday we were here, but it's actually a few months, I think, remembering back to March and April, and then we kind of took a break from the press conferences, and our numbers stayed so low, and now we're starting to see our uptick here, which was expected. The only question I think that we had was when. And I think early on, all of us were just waiting for this to be over, but we know this is not going to be over until one of two things happen, and that's till enough people have been sick, which we are nowhere near, or a vaccine comes out. So with our uptick starting, we know it's not going to end. It's going to continue up. So a lot of planning has continued throughout those months. So Randy talked a little bit about one of the limitations being staffing, not so much space. And so I want to go over some equipment and some of the things that could potentially be limiting and how we treat some patients. And one of the questions that's always asked is how big is the COVID unit? How many beds do you have available? And when you talk about a unit, it's really about what staff do you have to take care of those patients, because a COVID unit is really separating out staff to take care of those patients, not so much a particular bed. And so our plan, which was started way back in conjunction with the state and every other hospital around the state and the country, is completely scalable. Our limitation is not space, because as a wing of the hospital, which we're using currently for COVID, and you heard Randy talk about the numbers, we have 11 out on the floor. We have a total of 16. Those other 5 are in ICU. And that wing can expand out into another wing or to an entire floor. The question is, where do we limit and have staff to take care of patients? So it's not about a unit, it's about staff and equipment. We have at Trinity, our normal supply of ventilators is 18. That's what we own and have in service, and most of the time they're all in service. Occasionally one is rotated out for regular checks and servicing. To date, I believe we have 5 patients on vents in our ICU. That number varies normally from a handful like we have today all the way up to almost all of our ventilators being used on normal days without COVID. So COVID has not affected our ability to treat with a ventilator. Only the very sickest patients end up on ventilators. In fact, the prognosis is very poor for COVID patients when they end up on ventilators. So we are sitting okay with ventilators in our hospital currently. And as far as plans, if we reach that maximum, we have to reach out to the state, just like every other hospital does. And we have the large network of the state coordinated by the Department of Health to share equipment, and the state itself owns and has things like ventilators sitting in the warehouses around the state. So we are not, at this point, limited by things like ventilators. The other piece of equipment that we have been watching very closely, though, is protective equipment, like the masks we're wearing today. On a normal basis, a hospital goes through a fairly large amount of personal protective equipment. You go into ORs, you do certain things, you're wearing this. With high respiratory illness of any year, you use more. Flu season, we use more. With this pandemic, we've used a lot more. We're handing masks to even people coming in some places as visitors. So we have to watch those numbers closely. Luckily, being a hospital in a state where we're somewhat isolated from supplies, our stock level was kept at a pretty high level for most things in our warehouse locally, which is good because there are items that we have not gotten a single shipment of since COVID started for us back in March. Just like the country ran out of toilet paper and it took a while for supply chains to come back, and you can't go buy more than one package because they're limiting that, the same thing is happening around all of those supplies. So we are sitting okay, however. We worry about things like N95 masks and so forth. We have stock that was sent out through the state cache. We are into that stock, using that. Like I said, we've not received some items at all. We've received some trickle of items, but we report out on a regular basis what we have for supplies. We measure how many weeks worth of this at current use. But that week, which could be many weeks right now, if numbers go up, is going to get used quicker. So we have to be diligent in how we do that. Our staff has been amazing in reuse of certain masks. We actually have the ability to clean and sterilize N95 masks, which we've been using. They get sent to the state, sterilized. They're actually coded, so if a mask that I'm wearing goes down and gets sterilized, it comes back to us at Trinity and back to me as an individual. So they're not shared that way. So our staff has really been diligent in that. So we have this large network that we work with around the state to make sure we all have supplies that we need. I want to touch just a little bit on testing and treatment. So you hear in the news all the treatments that are being used, and we are using those here locally. Remdesivir has been out and has been used. That's the antiviral agent. That was a couple of months into COVID. That really came into being, and a supply of that was sent out. We have used that here. We do have it in stock. It's one of those medicines that is in very tight supply, and that supply chain is controlled by the feds. A certain amount is allocated, I want to say on a 2-week basis, I might be wrong on that, but at certain intervals from the federal government allocated out to individual states. Then when the state gets that allocation, the state has a formula based on hospitalizations of patients to say, Trinity Hospital, this is your share. So it comes, what share does North Dakota get? What share does individual hospitals get? And we get our share to treat as many patients that need treatment with that medication. And to date, we've treated 25 patients with remdesivir. There's fairly tight criteria around it. People that aren't sick don't need it. People that are starting to get sick do, because it can minimize the illness. The sickest of patients, it has not shown good results. If someone's on a ventilator, for example. The other thing that we've used is convalescent plasma. We've treated about 20 patients here at Trinity with convalescent plasma, and that's supplied by our in-state blood supply company, and they've done a good job. All patients that have needed it have been able to get it thus far, and it's been reported to me through our infectious disease physician and those taking care of those patients that it seems to be helping as well. Testing, I just want to touch on that. So we do have limited in-house capability for testing. When I say limited, we have the machines to do the testing, but supplies, again, are on an allocation basis. So we get very small amounts of what you would call point-of-care testing, the ability to test someone and have results within the hour. And so we have strict criteria around how those are used. We test in-house some of the sickest patients, so we know that we're treating people right. We're not testing in-house, for example, outpatients, people that just want to be tested. Those are going off to the state lab simply because we do not have the supplies to do that. So for regular testing, pre-surgicals, outpatients, people that just want to get tested, and anybody that wants to get tested will get tested. You don't have to meet any criteria, you simply have to call. We're doing that in a drive-up basis by appointment. So you call in to 857-7817, and they will tell you the time and location, and you drive up in your car, and your information's taken and you're swabbed. The limitation in drive-up testing is not actually the taking of the swab. It takes about 3 clerical people just on our end for that one person getting swabbed, between getting all the information and answering the phones and all of that. And that doesn't include downstream testing at the state lab. So there's a lot of manpower that goes into this. Today, for example, we are swabbing 121 people at our drive-up. We see over 100 pretty much daily now, and have had as high as 160s, I believe, is one of our highest days for testing. One thing about testing, the test itself isn't a check that I'm good to go. It's a marker of that point in time. And you have to also remember that this, like every disease, there's an incubation period. I could have got exposed at Walmart today and go, oh my gosh, I was in Walmart, I'm worried, I didn't wear my mask. Maybe I should go get tested. It really does me no good to get in line tomorrow and get tested, because I'm not going to be positive for anywhere up to, the most common time is about 6 to 8 days, but 5 to 10 day range, you want to consider possibly getting tested. If you go before that, you're probably not going to be positive from that exposure. And if you do go get tested, that just means you're negative then. You may have been exposed the day before or got exposed the day you got tested. So it's a measurement in that point of time, especially when we're talking asymptomatic people. We are finding in treating sick people, we have patients that come in the hospital that have the symptoms of COVID pneumonia, and we test them and they come back negative. And then we retest them a day or two later and they're positive. So this test isn't everything. You have to take it in context. But testing is available for all of those that want simply by calling that number. So Randy, I'll turn it back over to you and I'll be available for questions.
Thank you, Dr. Stather. So we talk about masking. You've heard it from all of us so far, and I can't overemphasize. And so I'm letting you know that over the next few days and weeks, you'll be seeing more information, both from the governor's office as well as from a coalition of healthcare providers in Northwest North Dakota, North Central North Dakota. Our critical access hospital partners across this region and Trinity Health and First District Health are teaming up with other agencies, public and private agencies in this region, to launch a Mask Up, Save Lives campaign. And the Mask Up, Save Lives campaign is just reiterating what you're going to see elsewhere, what you've heard here today. You'll be reminded by outdoor messaging, other kinds of advertising, testimonials, and so on, urging the community across this Northwest region, North Central region, to mask up, save lives, because it really matters. So at Trinity Health, we've seen a steady increase of people who come to our facility wearing masks, which is great because we have a mandatory masking policy at Trinity Health. You'll wear a mask if you come in the building. We ask that you bring your own mask, and until we have supply, we'll offer you one if you don't have one with you. But 90% of the people who come to our facilities now bring their own. So that's a shift, a big shift. I think last time we were in this room, it was 50-50 maybe, even after we'd implemented the policy. So I think most people get it. And we need to make it more comfortable for all people to get it. And so we all know people who don't want to wear masks. I'm included in that group because I don't want to wear a mask. But you call me out if you see me in the public and I don't have a mask on. I expect to be called out, as I will ask you too. We have to depend on each other to keep each other safe. So mask up, save lives. We do have testing going on at Trinity Homes. It's, I think there's 7th or 8th rendition over at Trinity Homes of residents and staff. They've been busy testing for weeks and weeks. They recently did have another positive test. And so with that comes retraction of some of the plans to open the facility for visitation. So you'll see that visitation at Trinity Homes for residents will be for folks who are scheduled and have an appointment to use the room. We have a room that's available to do that. Other means of visitation using electronic devices, telephone, mobile devices, and so on and so forth will still be maintained by and offered by the staff for the resident if you wish to visit. It's a difficult situation across the state, across the country for nursing home residents to not have family contacts, so I encourage you to reach out to the staff and try to accomplish one of those visitations, if at all possible, until we can get control of the virus as a nation, as a community. Those visitations will be hard to accomplish. But our staff will work with you to get that done. I think in wrapping up my comments, I just wanted to point out that we've been at this for 6 months as a country and as a community, right? We're all tired, right? We want the lives we had before, right? So emergency workers, healthcare people, journalists, school officials, city officials, We're all tired of this. And with that fatigue comes frustration, right? And so we have to give ourselves a little bit of grace and each other a little bit of grace with our patience, with our replies, with our expectations. I think you heard a little bit of that earlier. So it doesn't help that we have conflicting messages both in the healthcare experts arena and the political arena, at every level of our country. So we're imploring people to pay attention to the evidence. And the evidence says masking, social distancing, hand hygiene are still the one way, the only way we're going to get our hands around this thing, right? So just kudos to the staff on the front lines, wherever you are, including healthcare and emergency workers. We need to support each other. We need the community support each other and community support for those folks that can continue doing what they're doing on the front lines. Thank you.
Thank you, Randy and Dr. Sather. Up next, we have Dr. Mattern from First District Health.
Good afternoon, and welcome to the craziest sports season I've ever witnessed and will ever witness in my life. This is usually a time of the year where I take my last bathroom break and I say goodbye to my family and I start on the sports seasons. But wow, what a change. Here in Minot, in this area and in North Dakota, we have been given a chance. And we've been given a chance to try and play and to participate in sport and to go out and be active. And I think that's an incredible gift that we have to take responsibly. We have many guidelines and recommendations and goals and standards that we are asking our athletes' families, our coaches, and downright our community to take so that our kids can participate in sport. A lot of those recommendations come down from various sources, whether it's USA Hockey, USA Swimming, to the High School Activities Association, to whomever. I've got a stack in my office that's almost taller than I am right now of recommendations on how we can do this. And it's gonna be tough, and we're gonna hit some bumps and some hard steps along the way, but the bottom line is we get a chance. We get a chance. High school football has started. We are practicing. We've actually had a week of games for some divisions in the high school setting. Volleyball, cross country, we're starting all over with those sports and getting these kids hopefully back into something that they love and love to do. Some goals for me along the way is, you know, I kind of like the masks because now my coaches can be a little bit more quiet, right? Let that kid have some fun out there. And that's my biggest goal this year is, hey, you know what? Let's have fun. Let's get through this year, develop some skills, and move on. I take very seriously the recommendations that we have set with our teams. I have athletic trainers that are out working. I have folks with First District that are working with various different schools and teams on different levels on what we can do to keep us safe. And we're not just making those recommendations because we have a coaching degree or think that we can make your offense any better at scoring. We are just making those to see if we can continue with this chance we've been given. Youth football even starts, right? So my 5th, 6th graders get to start for the first time getting into a team sport like that. I want this to be a very happy experience for them. I don't want them always worried about who's got a fever, who's sick, have I been around somebody, am I gonna get it, am I gonna end up? I want them to go and play. But I also want them to be the first ones to step forward and say, you know what, I don't feel good today. And I really encourage parents to be honest with their kids. Kids need to feel safe in saying, I don't feel good. And if they aren't feeling good, I sure the heck don't want them around a lot of other kids, whether that's at school or at the football field or playing baseball in the neighborhood. I want them to be able to take this on as not only their health, but as their friends' health and the community's health. I think the reason why I think this season is going to be the most challenging is because for the first time, I almost feel safer having them at practice because I've got 2 hours where I know what's going on. But what happens in the other 22 hours of that day is what might scare me. And that might scare me a little bit more for high school, and that scares me a whole lot more for the college kids on what we do out of our sport time. And never has it been more important about those hours impacting what my play is. And the choices I make, whether I hang out with large groups or in large gatherings or lots of different gatherings, that kind of thing, that all impacts my season and my entire team's season. And I think that's a pretty heavy load that we have to help our kids shoulder as we go forward. I hope every kid, every family member has had that discussion about is this the right time for me to be in a sport? Because there are many reasons why you should rethink being in a sport right now. And a lot of those are specific only to you and only to your family. And I really hope that our coaches, if they notice that someone's not on their roster that usually might be on a roster, reaches out and maybe Zooms a few soccer lessons or football drills or other things that we can do and reach out and stay connected with them. I talk to all my athletes with their physicals. If they're in my office, we're talking about getting your own water bottle. In fact, I saw the greatest bedazzled water bottle I've ever seen in my life. No one else is going to touch that water bottle. And that's absolutely perfect because they need their own. They need their own water bottle. They need their own towel. They need to be able to say, this is mine, I'm keeping it safe, and move on from that. I want practice to be a safe place for them. I want it as social distance as possible. I really want my coach writing down what they're going to do so that they have a plan and they know what kids were where at what time. Because if I have one kid who ends up getting sick or is an exposure, I don't want my entire team to have to be defaulted into, I was a contact. I want to be able to help them muddy through those waters and hopefully come out with a let's make sure that we're taking care of who we need to take care of and push forward with the rest. So I think it is an incredibly challenging, unstable time, but we've been given that chance, and I'm so excited we've been given a chance to do that. So thanks for your time, and I'll answer questions if you got a few before I got to run to a next event, but thanks.
Thank you, Dr. Mattern. Up next, we have Dr. Mark Vollmer and Jim Rosted from Minot Public Schools.
Point of clarification, Don. No mask is going to stop our coaches from hollering. Sorry about that. On behalf of the Minot Public Schools and also the Ward County Commission, I wish to thank Jennifer Wichman for the outstanding job she's done, and Dr. Vollmer and his entire committee that has worked tirelessly on setting a plan for the Minot Public Schools for the upcoming year. This is going to be a most difficult situation, especially for our classroom teachers. Those are the point of the sphere we're going to be relying on. And let's not underestimate the job they have ahead of them. And Randy, as you alluded to, the masking is so important. But when you've got over 6,000 students in class for 8 hours a day, we're going to have problems doing that. And so it comes down to our classroom teachers to give them breaks where it's appropriate. And I think we realize that so we can get the kids that they go ahead with this plan and realize the importance of it. And So our classroom teachers are going to be wearing the heavy load for the Minot Public Schools, and we fully realize that. Also, not only the staff, but the students. And I'm going to just reiterate a little bit what Lisa said, and she said it much better than I can, but personal responsibility on behalf of the students is going to be required. And wearing a mask and washing your hands or hand sanitizers, they're going to have to get used to it, and it's not going to be easy. So, but we will get through this, and hopefully sometime in the future, we're going to look back and say, you know, this was the experience we went through. Lastly, on my part, there's someone in the audience who's already testified, and that is someone who's absolutely led the Minot Public Schools through this thing and our plan, and that's Lisa Clute. She has been absolutely the go-to person that we've relied on, and Dr. Vollmer has relied on day after day after day. So just thank you, Lisa, for just doing an absolutely wonderful job. And I know you've been through a very challenging time, to say the least, in your career, but you are so appreciated by the Minot Public Schools. So thank you for working with us on a daily basis and for the last months and the months to come. So thank you. And with that, I'm going to let the guy who's involved in this day to day, Dr. Mark Vollmer, please share.
Thank you, Jim, for your leadership and your support through all of this. I just kind of want to recap where we're at. As a school district, we are starting school with students on August 27th. That is with the exception of about 1,100 students at this time who have indicated they plan on distance learning. They're going to be beginning on August 31st. Teachers are busy preparing, as Jim mentioned, for a very interesting school year, knowing that our plans have to be fluid as we continue to move through this process. So in order to ensure that we are ready for the school year, the following expectations are in place. We will begin the year with students in session, other than, again, those students have opted for the distance learning model. Masks will be required. While there will be mask breaks built into the daily schedule, we want everyone to know and to expect that masks are the rule. Masks are not an exception. If your child has a medical reason that dictates they cannot wear a mask, we ask that you contact your school principal. We have other options we can work with for you. Distance learning, a lot of discussion on distance learning. Our distance learning program will parallel in-person learning with emphasis on a very rigorous application of skills. All of our students in grades 5 through 12 will be assigned a Chromebook, whether they are in person or at home. And schools will work with families who have opted for distance learning to make sure they have all of the materials and technology ready by the time they begin on August 31st. The district will use PowerSchool as our communication platform. All virtual learning will be done through Google Classroom. That will be similar to what was happening last spring, with a primary exception that distance learning will be online much more with their instructor than they were expected to be last spring. Those distance learning students will be expected to be online with their teacher. We expect them to actively participate in lessons and activities. In-person instruction, our in-school instruction is also going to involve the use of PowerSchool and Google Classroom. And in general, we will do everything we can to prepare our in-school kids to be readied for distance learning if that need would arise. Families who have selected the distance learning option, we've asked them to commit to a 9-week period or 1/4 of the school year. At that time, they would be allowed to continue, or they could return to school. That would be their option. Reintegration plan approved by the school board is fluid in nature, and we will continue to work with First District Health, as Jim mentioned. Lisa and I have spent a lot of time on the phone together over the last, 20 years or something like that, Lisa. Through H1N1 and the flood and COVID. We'll continue that work on a daily basis. We're constantly assessing our current reality, and we work collaboratively collaboratively to make the decisions that, as in the words of Governor Burgum, are based on fact, not fear. Since March 15th, we've continued to work collaboratively with local and state officials to determine the best course of action moving forward and to meet our mission of empowering all students to succeed in an ever-changing world, and what an ever-changing world it is. We have no guarantee of what our future might hold. We do recognize, however, that with the help of great partners in the decision-making process, we have a plan that will allow adjustment as we continue to evaluate many data points. We'll strive to provide adequate notice to parents if the district transitions to a hybrid model or a distance learning model. And I'm often asked, what can I do to help? Here are some ideas. First, if you're a praying person, throw a few up. We could use some prayers and some support. If your child is sick, do not send him or her to school, especially if they exhibit symptoms that are commonly linked to COVID-19. Encourage your children, wash your hands regularly, access hand sanitizer, avoid touching mouth, nose, eyes, all those common recommendations. We ask that you avoid large gatherings. Our sports season is going to look different. We're not going to have gymnasiums and fields full of people. It's going to be a different season. We are going to be broadcasting many of our games, so family members will be able to watch, but we'll be having very limited access to our activities. We ask that you avoid those large gatherings. If social distancing isn't possible, we've got to have you wear a mask. If you or a family member test positive for COVID, please contact your child's principal immediately. Our state contact tracers are doing a phenomenal job. However, they are very, very busy. The quicker we get that information, the quicker we can begin preparing and being organized and ready to roll. So someone in your family tests positive, please let us know right away. Most importantly, reach out. If you have questions, our school and district leaders, as always, are here to help. Offer a special thank you to local leaders, state leaders who have led the way, supported our students through this unique time in history. And as we often say in our district, together we get better. This could not be a more true statement at this time. We will continue to monitor testing results, monitor where those clusters are, evaluate data with the help of our experts, and we will adjust our delivery model based on our current reality. Again, as of now, we will be starting school on August 27th, Thursday, August 27th, in person. I'll stand for any questions anyone may have at the end of the press conference, but I thank you for your time.
Thank you, Jim, Dr. Vollmer, and last but not least, we have John McMartin with the Minot Chamber of Commerce.
Thank you and good afternoon. Mark, thank you for moving that table. I didn't think my bike was going to get through there. Dr. Mathern said we have an opportunity, and yes, we truly do have an opportunity because we live in the great state of North Dakota. We live in wide open spaces, and we tend to take some things for granted with those wide open spaces. The other words I heard today were personal responsibility. We've got a personal responsibility to ourselves, to our families, to our friends, and even to Randy Schwann. I mean, for God's sake. So, mask up. That's my message here today. We've spent 6 months trying to figure out what the heck this is. And it doesn't look like it's going away anytime soon. People have kind of taken a chance and said, maybe it isn't going to hit North Dakota. But as we've seen every day, the numbers keep inching up. And if you look at some of the trends, those trend lines where those things are along the 2 interstate highways and along US Highway 2 in the northern corridor. So movement of people does move that virus around, which means even though we're sitting up in north central North Dakota, we are not immune. we continue to encourage you during this time to maximize Minot here. Let's buy, invest, and hire locally. And by hiring locally, I mean hiring local professionals, be it a doctor, an accountant, a lawyer, a contractor. Let's keep our friends and neighbors working here in town. There absolutely should be no reason to shame or ridicule somebody because they wear a mask or because the proprietor of the store requires you to wear a mask if you're going to go in. Those proprietors operate in a free enterprise system. They set their own hours, and they get to decide what the operating rules are in that store. And if they say mask up, or shop someplace else. Masks are critical. We need a strong economy in our area. We see it every day. We see it in the sales tax reports. And it depends upon all of us choosing local, but also helping to slow the spread of COVID-19. And the best way that we've got is the campaign that Randy made reference to, and masking up, washing our hands, and taking care of ourselves and being personally responsible. It's vital to how we're going to move forward. Thank you. And I'll be happy to stand for questions too. They tell me I'm not supposed to back up, but I don't know what else sometimes.
Thank you, John. We have opened up for questions now. Start on the left-hand side of the room. Jean?
Lisa and Dr. Bowman. So Lisa, if you could tell us a little bit more about the data that you, without giving obvious HIPAA information, but the data that you now have access to that you didn't before that will help the school district determine whether or not there is a COVID-19 threat. And then if we could give a scenario of what that might look like if you discover that there are 3 or 4 cases in a particular school, how would your conversation with Dr. Homer would go in that circumstance?
First of all, we have a wealth of epidemiology information that we are looking at. Dr. Wigway is our health officer and reviews that information and assists us in interpreting that. We are looking at clusters particularly. We have cases in churches, businesses, daycares throughout our community organizations. Some of those cases can occasionally turn into clusters. We look at those clusters and we're looking at age groups of those clusters. And then through contact tracing, you're able to identify where they're going to school and so forth. That's part of the contact tracing. When there is any case in school, we contact the school point of contact. Then that information goes to, they have a well-oiled machine going on right now here. And I just have to, Jim said some very nice things about me, and I appreciate that. I'm nothing without this staff that are supporting and doing the work here and the real work out there. I've set up a task force of 5 individuals at First District Health Unit, and right now their sole responsibility is to work with these schools, and they're on 24/7. So if information comes out that we have a positive case in the school, all the schools have a point of contact that our staff contacts. Those schools, and we witnessed some of it this past week, are doing an outstanding job. Holly said within 1 hour, this point of contact in the school had identified all close contacts, and they were moving on it. So then we assist them in getting out letters to those contacts and isolating that out. So does that answer your question, Jean?
It almost sounds like you have a contact tracer as your point of contact in the school, so that person takes the information.
That's correct. The schools are doing a lot of their own contact tracing, and then we're there to assist them. So the point of contact in the schools initiates contact tracing.
Okay.
Yes.
So you have had, even though school's not open yet here in the Minot Public District, you have had a case maybe with, I don't want to, but with somebody working within the school, or a person within the school. So you had to do, it was almost an opportunity for you to do a practice run, so to speak.
Yeah, just reminding that we serve 7 counties. And so, yeah, we have, this past weekend, we
Now put it into play.
have put it into play.
And you are contacting not just Minot School District, you are contacting all schools within your 7-county area.
Correct. We have 38 school districts in our district that we are working with.
Okay. I don't know if you have anything to add to that, Dr. Holman.
Yeah, Jean, thank you. We have a system where I'm the district contact. I'm the one that is contacted. I notify out to principals when there is a positive or a quarantine. I've had some people ask, why are we doing this now? And the reason is simple, because when somebody's quarantined, if they're quarantined for 14 days, they have a return to school date that is being provided in that initial memo. And we're logging that. We're required to report that to the North Dakota Department of Public Instruction. And that helps monitor us. So I'm getting that word out immediately then to principals, so they know that if a student or a staff member can't return to work, what the reason is and why, and then we begin. That if a student or a staff member can't return to work, what the reason is and why, and then we begin. I don't know what happened there, but that's how we're that if a student or a staff member can't return to work, what the reason is and why, and then we begin. I don't know what happened there, but that's how we're that if a student or a staff member can't return to work, what the reason is and why, and then we begin. I don't know what happened there, but that's how we're that if a student or a staff. So we're communicating daily, many times a day, daily, and we could have many cases that would be in a long-term care facility, wouldn't have the level of impact that maybe 5 cases in an elementary or middle school would. So, it's really hard to say. There is no magic number or no slice of a pie that would indicate where we go, but it's just constant monitoring those numbers. So does that answer your question, Jean?
Yeah, but of course I have another one.
Of course.
Does the number of active cases, the increase here in Ward County, we're at 140 active cases today, compared to a lot less when you drew up this plan.
Mm-hmm.
Does that give you pause or give you concern where we're at right now?
I have been nothing but concerned since March 15th. And, this weighs heavily on all of us. What is the right thing to do? One of the things we do know, if we wait until there are no COVID cases, we're never going to be in session. I still believe we have to base this on data. And, I'm not privy to where these outbreaks are in the community. Lisa is privy to that information, but we communicate regularly. We share that information. We're going to make the best decision we can. We have families that have the option of distance learning. Over 1,000 have taken us up on that offer for this year. And we're going to move forward cautiously and do the best we can to make the best decisions that we can. But does it weigh heavily on it? Absolutely. Day in and day out. and weekends. I mean, we're constantly evaluating and communicating. So not easy decisions to make, but we're here to do the best we can.
Can a student move to distance learning in the middle of the quarter if they decide?
You know, we're a people-friendly agency, and we will do what we need to do what is best for an individual family. So they need to contact us if they're having concerns. Conversely, what we can't have is students dropping in and dropping out, but we will work with families. We're about kids. It's what we do. Okay.
Who's next? Jill? Lisa?
The number of cases in this pool has been surprising, but particularly in Ward County. So I'm wondering if there's some things that could be attributed to, or there things people should be doing or should be aware of?
Would you repeat that? I'm sorry, I missed the first part of it.
I'm just gonna ask.
Okay.
The number of cases have been rising, particularly in Ward County. I wondered if there's anything that is being attributed to. Is it just general, you're seeing it across the board, different age groups, different activities? Or are there certain things that maybe is a risk we should be aware of?
So the question is, the cases have risen in Ward County. Is there anything that we are seeing consistently with those rises or any concerning information? The one thing that there is not one particular large cluster that this is spreading from. You know, it isn't like we have one large workplace or something like that that just keeps getting larger. We are seeing cases throughout the community, a little bit here and there, and some have formed into clusters. We do have some clusters out there that we are monitoring and watching to see how those clusters move. A big part in all of that is public's willingness to work with us and participate in contact tracing. And when they don't do that, then we don't know how far those spreads are going. So I can appreciate that, you know, nobody wants to hear the recommendation that you stay home for 14 days and isolate to avoid spreading the virus. However, you truly are helping out your community, neighbors, to keep these education systems going, to keep what Dr. Mattern is saying going. We want to do that, and so cooperating with contact tracing is important. We have seen more resistance to some of the contact tracing or not participating as well with that in the last month. The other thing we do notice is that those ages tend to be younger people, more in that 20 to 40, 50-year-old range. That's where we're seeing most of the cases right now. So.
In the beginning, you had problems with contact tracing and were prepared to exercise your authority by charging them with a misdemeanor. That apparently has changed, or let's talk about whether or not you'd be willing to do that again.
Well, I want to emphasize that the state health department right now is doing the contact tracing. We aren't doing the contact tracing. So that has changed from previous press conferences. So thank you.
Anybody else? Jean?
Gene.
Could you explain a little bit further why you can't give us daily counts on the number of COVID patients in Trinity Hospital?
So the question was, is interested in knowing daily counts of positive patients coming in Trinity Hospital. I can tell you, just as the number of other patients coming in, it's a very fluid situation. There's patients that aren't COVID positive that come in, are in the hospital, as Dr. Sather pointed out, and convert to positive. There are patients that were positive, are retested, and are negative. There are patients who are positive and are discharged, and 3 more come in. So just the running total day-to-day of how many positive patients are at the hospital. One, it's a moving target. It's not discernible at any one time very easily. We can summarize that over time as we get data. But I guess we're just not poised to give running tallies of different types of patients coming into the hospital.
Is it something you would consider doing given the threat of this virus on the community? Don't you feel as if, even if we took a snapshot at one time during the day, every day, isn't it important for the community to know how many of their friends and neighbors are in the hospital with COVID-19 at, say, noon every single day?
Well, I think that most of that information is readily available by the state data that they put out, isn't it?
No, it's only available on a statewide basis. It's not available on a localized basis.
Okay. And I guess I'd have to ask the information that we'd give about patients coming into the hospital. We're a regional hospital. We get transfers in from all over the state. A lot of the patients that come into our hospital are not Ward County patients. So I don't know. Again, we'll talk about, if you wish, a system that we might get that can give you more timely information. And I apologize if we have not done that. So as for day-to-day tally, I'll explore that with you.
And you mentioned that you've been at capacity in some units. Have you ever, and I realize, I understand the explanation about staff, being able to move staff around, but have you ever been to a point where you've had so many COVID patients that you've had to make adjustments to expand your capacity?
So yes, we have actually. We've expanded capacity forward and backward based on the number of COVID patients we have and the staff that are able to treat them. So as we have in other units, whether it's our ICU and other just med-surg units. So it's not been rare that we've had to flex up and down COVID patients and other units. So it's an activity, as I described earlier, that we do every day. And it's not that unusual for us to have to expand or retract those units. So right now we are, as Dr. Sather pointed out, the number of COVID patients that we have between the floor that we typically house them in and ICU is nearing capacity. So we're preparing to flex up into a different area of the hospital that we've pre-planned that flexing to take place in. And we've worked with the state of North Dakota and other people across the state that if we have to flex up into other facilities, whether they're our facility or other community facilities, that we have the capacity to do that. And we've not had to do that anywhere that I know of in North Dakota. The hospitalization rate across all regions has been managed by the local facility using their normal spaces, I would guess. I don't know of any other facilities in the state, including ours, that have had to move outside of their normal hospital facility into another facility, but we're prepared to do that, and we haven't had to do that yet. Yes, ma'am.
Do you have a call to the community to provide more masks like this one or the N95s that they're printing with their 3D printers? Is there a call to action with that with the community, or do you think you're okay right now where you're at?
I think the question was, how are we doing on our mask inventory, and have we had to appeal to the community for help? So thank goodness for the community's generosity and those who both provided hand-sewn masks like the one I'm wearing, or 3D printed masks that we use in place of a surgical mask. We are deploying those 3D masks across the system. Very grateful for the group of people who helped produce them. We are not finished in that effort. So if folks have 3D printed masks or hand-sewn masks that you want to get rid of, or make more of, we would certainly take them. As I said, we've been in a mandatory masking situation since near the beginning. It takes a large number of masks to satisfy that requirement. So we have been able to keep up with the hand-sewn masks. We have been able to keep up with N95 masks through the re-sterilization, as Dr. Sather pointed out. But if you have masks of any type, I'd certainly invite you to call our clinical excellence patient safety coordinators so that we can look at them to see if we can deploy them. But I'm guessing, yes, we would be welcome to that. Thank you.
If numbers stay the same, how many weeks of PPE do you have?
Pardon me?
If numbers stay the same, how many weeks of PPE do you have?
Yeah, so it varies based on mask type, mask size, mask model. There's a lot of different variety to that. Some masks are easily obtainable or more easily obtainable. Some masks in certain sizes are not obtainable. And so depending on the make, model, and
Let's go with N95.
that's what I'm talking about, N95 particularly. There's many different sizes, there's different styles. Some we can get, some we cannot get. So I think we are weeks out at the current burn rate for most of the things that we have. In some cases, we can't get any supply and haven't gotten any supply of that particular model or item for more than a month. So we have zero. We have alternatives, and we're using those alternatives. But we look forward to the day when the supply chain is back in a repaired mode and able to supply us with the PPE that we request. As Dr. Sather pointed out, we are sitting okay. We're not great. I don't think any healthcare organization in the country is sitting great with its PPE. So we have a pretty robust program on reuse and prolonging use of PPE, and through a variety of different techniques, we've been able to stretch our supply. We're not at a critical level with that yet. But there are some pieces that are missing, and we're trying to overcome that by finding new resources. As you recall, hand sanitizer was among those things that across the city, across the country, was in very short supply. And we were securing hand sanitizers of different manufacturers, different kinds, all around the country. 55-gallon drums were used, and we repackaged that into smaller containers around the hospital and clinics. So we've been resourceful and innovative in providing that inventory. We'll continue to do that. It demands that level of daily work, but we got great people doing it. And so I think we're okay right now. Okay.
Any further questions? All right, seeing none, thank you all for coming. We don't have another press briefing scheduled at this time, but as the numbers and events dictate, we will review that and let you know if we have another one. Thank you.